Gestational diabetes. Let's talk about it. What is gestational diabetes? Gestational diabetes is defined as carbohydrate intolerance, which is first diagnosed during pregnancy, typically between weeks 24 to 28. Why does gestational diabetes develop? The placenta, a temporary organ that develops during pregnancy, naturally produces hormones that affect blood sugar levels. In most cases, the body adapts to these changes. However, insulin resistance may occur due to risk factors such as genetics or being overweight. This means that the natural insulin secretion is insufficient to manage blood sugar levels, resulting in gestational diabetes. How is gestational diabetes diagnosed? Every pregnant woman undergoes a screening test between weeks 24 and 28. This involves drinking 50 grams of glucose after a light meal at one of Maccabi's medical centers. Blood sugar levels are measured 1 hour after drinking the glucose. Women with glucose levels above 140 milligrams per deciliter are referred for an additional glucose tolerance test involving the consumption of 100 grams of glucose. Gestational diabetes is diagnosed when at least one of 4 measured values exceeds the normal range defined for the 100-gram glucose test. Why is it important to treat gestational diabetes? Untreated, gestational diabetes can lead to both short and long-term complications for both the mother and the baby. In the short term, the primary complication is excessive fetal growth, which may result in a large baby. This increases the risk of complications during delivery and the likelihood of a cesarean section. In the long term, women with gestational diabetes are at higher risk of developing type 2 diabetes later in life. Additionally, babies born to mothers with uncontrolled gestational diabetes are at increased risk of developing obesity and diabetes during childhood and adulthood. What should you do? Remain under medical supervision, preferably with a multidisciplinary team at Maccabi. Get to know your care team. Maccabi nurses will guide you through measuring your blood sugar levels using a home glucose meter or a continuous glucose monitor. Dietitians will provide personalized nutritional guidance. Physicians will monitor your pregnancy. Social workers will offer support as needed based on the team's recommendations. You're not alone on this journey. Additionally, you can join groups and workshops focusing on a healthy lifestyle and physical activity during pregnancy. What happens after birth? Congratulations on your new baby. Around 6 weeks after delivery, you will undergo a 75-gram glucose tolerance test. This test is crucial as it helps to determine if your blood sugar levels have returned to normal after pregnancy. Attending a follow-up appointment with your doctor and dietitian at the clinic is essential. Together, they will review your test results and provide ongoing guidance for maintaining a healthy lifestyle, including nutrition, physical activity, and sleep. This follow-up care is crucial for your well-being and peace of mind. Remember, at Maccabi, we're committed to your health during pregnancy and beyond. Because at Maccabi, your health is everything.